Hello, everybody. This is Gary. Today is April 18th, 2022. It is 5:52 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, my paranoia levels are pretty high. Um, I was outside today and I had a doctor's appointment with this spinal doctor, the orthopedic surgeon for spine um, medicine. We're not going to do any surgery on my back. I'm doing physical therapy for arthritis and disc problems in my lower back. There's not going to be any surgery. I don't have any severe back pain. It was a very brief visit. My doctor just advised me to keep doing my physical therapy exercises for my back, and surgery is completely unnecessary on my back. But anyways, back to my paranoia. I was outside today and somebody asked me if I had a cigarette lighter and I said no. And I've been thinking about that all day, like he was spying on me or trying to follow me, even though he gave no indication he was doing that. My paranoia levels are pretty high today. I always kind of felt today that I was being followed or watched. I've been having that feeling a lot lately. It's part of my psychosis. Um, I have an appointment with my therapist tomorrow, and I will talk to her about it tomorrow. And on Thursday, I have an appointment with my psychiatrist, and we'll be going over all my meds and over my paranoia. Um, my auditory hallucinations are more intense than usual. They're telling me people are following me, spying on me. It tends to match up with my paranoid thoughts and feelings when my voices intensify. They tend to reflect and make my paranoia worse. So I'm feeling very, very paranoid today. I'm not violent or suicidal or anything like that. I'm in control of my behavior, but my auditory hallucinations are more intense today. My paranoia is more intense today. Um, as far as my depression, anxiety, my depression is pretty severe. I'm worried about my upcoming knee surgery. Surgery on my back is not necessary, but the surgery on my right knee is definitely necessary. My right knee is in a lot of pain today. It's very painful for me to walk on it. Um, I'm not scheduled for surgery until April 29th, so I'm basically struggling along until that date. Um, I have to get a COVID test done on the 25th, a few days before surgery. It's a requirement for me to get surgery to have a COVID test done within 3 or 4 days of my scheduled surgery. I know the date and the place that I'm having surgery on my right knee. I don't know the time. I won't know the time until the day before surgery, which makes it difficult to arrange transportation. But I think I'll be able to pull that off at the last minute. I've had 2 other surgeries in the past 12 months, and I was able to arrange transportation for those surgeries. This surgery will be outpatient. I will be going to a surgical center, a clinic. The surgery will take about a half hour. I'm presuming I'll be under general anesthesia, um, but I won't be spending any time in the hospital overnight. Um, and actually, the surgery is not going to be at the hospital. It's going to be at a surgical center, an outpatient surgical center. And the doctor, the surgeon, the knee surgeon, the orthopedic surgeon, told me the surgery shouldn't take any more than 30 or 45 minutes. And then I will be sent home on crutches. Crutches may be necessary for a day or two just so I don't have to bear all my weight on my right leg. But I'm very worried about surgery. There's nothing fun about it. Um, Trying to make arrangements for it is difficult. Um, I have to make sure I have all my meds ahead of time, stored up food, because I may be immobilized for a few days at least, and I may not be able to do any food shopping or picking up my medications or anything like that for 2 or 3 days. So I got to make sure I'm well supplied with everything I need for the day of surgery and the few days after surgery, because I'm basically on my own. I mean, I appreciate all the doctors and nurses and all that who are giving me surgery and treating me, but I'm basically gonna be on my own when I get home. Um, so I have to make sure that I have all my supplies and meds filled, my food, make sure my laundry's done ahead of time, make sure my apartment's cleaned ahead of time. Um, and all of this is difficult to do because I have pain in my right knee in the first place, which is why I need the surgery. Um, I'm just trying to stick to my daily schedule, just trying to stay away from the psychiatric emergency room. I haven't been to the psychiatric emergency room since October 30th of last year, so it's been what? October, November, December. About 7 months since I've been to the psychiatric emergency room, so in that sense, I'm doing well. I'm not falling apart. I'm keeping my shit together, doing the best I can, sticking to my daily schedule. I did do my physical therapy exercises today. I did exercise on my exercise pedals for an hour, and I was able to do my full daily schedule today. It's important that I keep routine and structure in my life. Um, it keeps a sense of normalcy, a sense of security. But I'm doing the best I can, struggling with physical pain and my paranoia, my auditory hallucinations. But like I said, I'm seeing my psychotherapist tomorrow and seeing my psychiatrist on Thursday. And on Friday, I have to go to the dentist. A lot of appointments this week. I had an appointment, like I mentioned earlier, today with a spinal doctor, but there was no surgery or anything necessary for that. Um, I will definitely be taking some Klonopin and some Aleve and some Zyprexa to relieve some of my physical pain and calm me down mentally. The Zyprexa is useful in suppressing the paranoia and the auditory hallucinations, and of course the Klonopin is useful in reducing my anxiety and helping me sleep better. Um, I'm still taking Cymbalta, Neurontin, and Flexeril for my body, muscular, skeletal, and nerve pain. That pain hasn't been as severe as it was, say, back in December. It's possible I have fibromyalgia. No doctor has given me that official diagnosis, but I am taking the same drugs that a person with fibromyalgia would take, including the Cymbalta, the Flexeril, and the Neurontin, which are for neuropathic pain, muscle pain, and muscular skeletal pain, and joint pain. So I'm on the working assumption that I have fibromyalgia, and the medications I take help with that. There's no doubt that my physical pain overall has been reduced since I started taking Cymbalta, Flexeril, and went back on the Neurontin. So other than that, there's not much going on. I will keep people up to date as much as I can. I have a lot to do. Today is the 18th, and I'm having surgery in about 10 days.